Yeah, so I'm Dr. Norm Bottom. I'm a physician here at the Haliburton Family Medical Center. Myself and Dr. Gammon look after the residents, and we're part of a group of 13 family physicians who do a combination of office practice and emerge work here in Haliburton. For those who don't know, Haliburton is located at the lower end of Algonquin Park. We're located in Haliburton Village, which is within Haliburton County. We service most of the county through our Haliburton Village location, as well as a satellite office in Minden. Haliburton has a population of approximately 16,000 people that in the summer months goes up to approximately 100,000 residents and campers and cottagers. Our main industry here, as you can hear from the population, is tourism. There is some logging operations, but basically we support an infrastructure that supports the cottage industry and camps and resorts within our area. We have a 14-bed hospital located in Haliburton, as well as 30 long-term care beds and a very busy emergency department. In Minden, we have an emergency department that's staffed by a different group of physicians and has a 60-bed long-term care facility. And there's a separate long-term care facility in town that also has 60 beds, so there's 150 long-term care beds altogether. So the physicians here supply services to the hospital through the emergency department. We do inpatient work. We have a palliative care bed that we service, as well as the long-term care patients in our area. Our residents get involved in all aspects of our practice, so they work in the office mainly 2 to 3 times a week, and maybe have 1 or 2 days a week where they're in the emergency department or visiting long-term care, and we'll encourage them to get involved with after hours on call, as well as inpatient work. Through the office, we'll see a variety of patients. We do have a large elderly population in Haliburton, so you'll see a lot of people with chronic conditions and doing a lot of work with seniors, but we do have some well women and pediatric care as well to round that out. A lot of those you'll see in the emergency department. We are just a group of family physicians. There's no specialists that work within our community, although we do have some visiting specialists. So our physicians do a lot of their own procedures, do a lot of internal medicine, so everything from lump and bump removals to biopsies to endometrial samples to IUD insertions, and a lot of casting and suturing in the emergency department. So in general, residents will get a lot of experience with hands-on opportunities. We do have some specialists that come once a month, pediatrician, cardiologist, urologist, visiting psychiatrists in this area. We also are well serviced with telemedicine services, so some of our patients will see their specialists through the telemedicine services, either at the Family Medical Center, the hospital, or the site in Minden. We are part of a family health team, so at our office, in addition to the physicians, we do have 3 nurse practitioners and a number of allied health professionals, allied health nurses that provide counseling for smoking cessation, chronic disease, pediatrics, newborn care, adolescent health, adolescent sexual health. So we're well supported through our family health team. Residents, when they do come, will be assigned to a team of physicians, so you won't be working with all 12 physicians, but you will be working with usually 3 main preceptors. You might be assigned the odd day, depending on holidays and that, with another physician. And we do have 2 full-time emergency doctors, and you might be assigned with them to do emergency work with them and their extra skills. So it allows you some continuity with your preceptors. A typical day, you would meet the preceptor at 8 o'clock in the morning at the hospital, do your inpatients and perhaps procedures. After your inpatients, you'll come to the office and see patients. Normally, you're going to be working with your physician off their list. So in an average day, you're going to be seeing probably 10 to 15 patients throughout the course of a day, which normally will wrap up around 4:30 or 5 each day. So we like to make sure the residents have lots of opportunity to have time to themselves to explore Haliburton County and the different activities. And we do have a condo that is shared with our residents and perhaps medical students when they're here. I believe it's 4 bedrooms. We're looking at renovating to increase the capacity, but at any given time there's usually 1 or 2 residents in the condo, and they're often bringing along family members for visiting or on weekends, because we want them to feel comfortable enjoying the area. The residence is approximately 5 kilometers from the clinic. The clinic is about 1 kilometer out of town. Residents usually will have a car and drive in, but they certainly can spike in. We've had a number of residents do that. Usually we don't try to make it too onerous. As I mentioned, you'll probably be in the emergency department at least 1 or 2 days a week, but of that you might end up with a Saturday or a Sunday. You might end up with an evening on call where you'll be on call overnight at the hospital. And we do have accommodations at the hospital that you can stay in the hospital overnight.